And for more on this, we're now joined by Senior Manager of the Regulatory Compliance at the South African Health Products Regulatory Authority, Deon Poovan. And he joins us via our video link. Deon, thank you so much for your time this evening here on SABC News. Perhaps if you can just maybe inform us about, the Benylin Paediatric Syrup, which has been recalled. Why has it been recalled?
Thank you and good evening. Two batches of Benylin Paediatric Syrup are being recalled. Our counterparts in Nigeria, NAFDAC, have tested one of the batches that they found on the market and found that the batch contained high levels of diethylene glycol. Further to that, we conducted further investigations with the manufacturer and we found that there was another batch, because they were packed as one bulk being packed into two lots. So there's two batches now that we found that have these high levels of diethylene glycol that now need to be recalled.
And looking at these two batches in South Africa, how many would you say are actually in circulation when we talk about the units?
So the batch shelf life is 3 years and the batches actually are expiring now in April. So we don't expect that there will be a lot of this. However, we're still cautioning the public to have a look and see if they have units of Benylin Paediatric, to check the batch numbers. If the batch numbers correspond with the two batches that we've communicated, to please return those back to where they've bought it from or to contact the manufacturer.
And what impact does diethylene have on children? I mean, if you're looking at this Benylin, which has now been recalled, it is, a medication for children. What's the impact on children?
So diethylene glycol is a contaminant, and the adverse events that you can experience with that is abdominal pain, vomiting, diarrhea, the inability to pass urine, headaches, as well as acute kidney injury. And what we urge the public is that if you've used these two batches and you've experienced these adverse events, to please contact your healthcare professional, especially if you witness it in children.
And how will the public know that, they are actually in possession of this, batch of Benylin? Because you are saying that, it is due to expire soon, and it seems as if it has been in circulation for quite some time.
Yes, so if you have the unit, which is still in its carton, on the carton there will be a batch number. So either the batch number for the batches that we are recalling is 329304 or 329303, depending on where it's been distributed. If you don't have the box anymore, the bottle will have a label that will also display these numbers. If you have these numbers, that bottle will be subject to this recall.
And what is your advice to South Africans who may have, this in their homes?
If you do have this bottle in your home, discontinue its use, take it to the place that you've bought it, or contact the manufacturer, or take it to your nearest pharmacy in order to have it destroyed, but do not continue to use it. Monitor for any adverse events if you've used it or if your children have used it, and then consult your healthcare professional for further advice.
All right, Deon, thank you so much for your time and for that update. That is Deon Poovan. He is the Senior Manager of Regulatory Compliance at SAPRA.